guys, Chris here with NP Sparkles and welcome to my channel. Today we are going to talk about post-op fevers and what they postoperatively could correspond to some complication. Now, just because you get the tips and tricks doesn't mean that you don't review all the body systems, but these are the things that we typically see post-surgically. So before we start, I would really be grateful if you would subscribe to my channel, click the like button, and also leave a comment to tell me if this was useful to you so that I can continue to generate content. Now, let's talk about the first thing, post-op day 1. On post-op day 1, what we look at is atelectasis. So after the patient's been intubated, they are unable to expand their lungs to their full capacity. Now, when we look at atelectasis, as a nurse, if you look at the patient, what you're going to probably see is a high respiratory rate and a low oxygen saturation. Don't forget to take your whole set of vitals and not just those. Because if you start seeing respers of 22, you can start being concerned, and along with a fever, even more. So how do we prevent this? The way to prevent atelectasis is to get the patients out of bed as soon as possible. Now, I know that some patients are in pain and they just don't want to get out of bed, and that makes sense. However, if we take the time to explain that the reason we're trying to get them up, even for a few steps, is to prevent anything going wrong with their lungs, and if we explain it in a way that they can understand it, then they will most likely be compliant. Now, once you have your full set of vitals, you've assessed the patient, now you call the doctor and let them know what's going on. Post-op day 2, pneumonia. Pneumonia has the same prevention tactics as atelectasis. So the most important thing is get them out of bed and perform the incentive spirometer. Now, when we talk about the spirometer, I want to remind you of a few things. Please take the time to go in the room and assess how the patient is performing spirometry, because it happens to me all the time that I see my post-surgical patients and I ask them to perform it in front of me. And this is what I see. That is not how to perform spirometry correctly. So I sit down and take the time to explain that they need to take breaths really slowly and really deeply. If they have trouble, just have them breathe in and out of it so it's easier and they don't have to take it off and put it back on. And then you encourage them to keep breathing, keep breathing, keep breathing, and out you go. And once we've verified that they do it correctly, then we know we've done our job correctly as well. So pneumonia will present probably just like atelectasis, except they may have a cough or they may not. If it's the beginning of pneumonia, you will see respiratory rate go up, higher than 22 usually, and oxygen saturation go down. It doesn't always happen that way, but most likely it will. So you take a full set of vitals and then you call the physician. Post-op day 3 to 4, what we look for is potentially a UTI. Now, a UTI might come with symptoms such as dysuria, hematuria, burning, but if they have a Foley catheter, they might not feel it. So if they have a fever, the first thing you're going to want to think about is that Foley needs to come out. Now, you might need a doctor's order, so you get on the phone, call the doctor, ask them, would you like us to remove the Foley catheter? Because all plastics, whether it's an IV line, whether it's a Foley catheter, are prone to attracting bacteria. So removing plastic comes first and foremost. There's no real prevention to UTI, unfortunately. You just push your fluids, make sure the patient is voiding correctly. If you don't see a lot of urine in the Foley catheter, try to reposition the patient, make sure that it's not kinked and the patient is not retaining urine. Post-op day 5 and 6. This is where we think about DVT or a PE, and these are obviously serious things. If you look at their vitals, their respiratory rate might be high, their oxygen saturation might be low, their blood pressure depends, unfortunately. There's not a way of determining whether it's high or low. And also, I want you to look at their extremities. Are they red? Is one of them red, especially, or swollen? If there's any kind of redness for any reason, And not only surgical patients, but any patient you ever have. If there is some redness, you take a Sharpie and you border the redness. And you make sure that the redness stays within the confines of that border. If it goes outside of the border, call the physician and let them know what is happening. So how do we prevent DVT or P? Well, first of all, certainly compression stockings, SCDs, get them out of bed as soon as you can, and assess. After surgery, the patients need to be assessed frequently, maybe even twice per shift, just to make sure that there are no complications. Post-op day 7 to 9 could usually mean a wound infection. Now, most of the time, surgical patients have surgical dressings on, and the surgeon specifically will say, do not remove it. But if there's a shadow that's greater than 50%, do call the physician right away, ask for permission to remove the surgical dressing, and remember to maintain as close to sterility as you can when dealing with these wounds. So look at the wound. Is it draining? What color is the drainage? What's going on? Is there redness? Is there pus? Because the doctor is going to want to know all of these things that are really important. And then always take a set of vitals and you call your physician and see what they order for you. If they develop a rash, that is most likely due to an allergy, either to an antibiotic they were taking, or some are allergic to some pain medication, which may cause a rash. So document the rash, take a look at the patient from head to toe so that you can be very specific with the doctor, and just call with a set of vitals as well. So this is it, my friend. Hope you find it useful. Next week, I'm going to start the series about how to update the healthcare provider on different symptoms that the patient may be experiencing, such as headaches or nausea or abdominal pain. And I will cover many symptoms and the most common symptoms that you will find. In each of my videos, we will discuss the symptom, we will discuss what you need to do as a nurse, and we will discuss all of the necessary information for you to have prior to calling the healthcare provider so you don't get in trouble or get screamed at. So I hope you look forward to it, and I hope to see you next week. If you click on the link below, there's a downloadable table for you to use as reference and keep with you in case you need it. Have a great day, everybody, and thank you for all you do. Bye.